Hi, welcome to the ASGBI East Midlands Journal Club. My name's Carla and I'm a registrar in this region, and I'm going to talk to you about one of our recently published papers called The Impact of COVID-19 on Surgical Training, a Systematic Review. This was published in January this year in Techniques in Coloproctology. So the rationale for the paper came about during the first wave of the UK COVID-19 pandemic, where we saw a massive reprioritisation of surgical services and lots of changes in a very short period of time. And practically for surgical trainees and surgeons, that resulted in elective operating being cancelled, an increase in dual consultant operating, and also more senior-led operating, particularly in the emergency setting. Along with other specialties, this wasn't unique to surgery, there was a decrease in the number of emergency presentations as well, which potentially reduced the number of emergency operative cases. We saw redeployment of surgical trainees to high pressure areas such as intensive care, and we also saw trainees that were out of programme for research being called back into full-time clinical practice. Outpatient clinics were reduced to seeing only urgent patients, with a switch towards the use of virtual clinics and telemedicine. And academic and teaching activities were cancelled, rescheduled, and then moved online. And so our aim was to describe the impact of COVID-19 on surgical training globally. And to do this, we performed a systematic review in line with PRISMA guidelines, and we pre-registered the study protocol on the Open Science Framework. Our searches were conducted across Medline, Embase, PubMed and Cochrane. And here is our PRISMA flow diagram reflecting the number of papers that were identified in the searches and at each point that they were removed. And we were left with 29 studies to be included that met the eligibility criteria. And that comprised 5,260 trainees and 339 programme directors. And 8 of the surgical specialties were included across more than 20 countries. Interestingly, only one paper from the UK was included. And we decided to perform a narrative synthesis of results based on themes that were emerging from the included studies. So the first was the operative impact. So as you would expect, there was a reduction across all studies in terms of the number of operative cases that were being completed and also trainee involvement in those cases. There was concern expressed over the ability to meet operative requirements for training grade or to complete training, not only by trainees but also by programme directors and trainers as well. And it seemed to be in a couple of studies that it was the most senior trainees that were the most concerned about this. So in a study of urology trainees that were in their final year of training, there was a reduction in their operative cases from 82% to 44%. And another study looking at neurosurgical trainees in the US and Canada found that it was the senior trainees that were much more concerned about the impact of COVID-19 on their residency education overall. The next theme was redeployment, non-operative impact, and change to working patterns. So redeployment varied quite a lot between the studies. It ranged from 6% amongst urology trainees to up to 46% in a study of Belgian plastic surgery trainees. There was also a reduction in trainee presence in general, so a reduction in trainee presence in outpatient activity, ward rounds, and some studies had reshuffled and reorganised rotas to more of a 1 week off, 1 week on system in order to minimise COVID transmission amongst the team and to make sure that they all didn't go down at once. Outpatient activity was reduced with a switch to telemedicine and virtual clinics. Some studies reported that this was only done by consultants, and a few studies reported that fellows and residents were included in the outpatient activity. Educational and academic impact was one area that was probably a positive to come out of this review. So the vast majority of trainees included in this review reported that there was a switch to online education, and that tended to happen quite rapidly within the early stages of the pandemic to try and minimise the loss of learning opportunities. It was received with mixed reviews. In studies that specifically looked at this, around half of trainees tended to be quite happy with it, and the other half thought that it wasn't really enough to meet their learning requirements. 3 studies reported that there was increased time dedicated to research since the pandemic, and 1 study found that there was an increased productivity of scientific papers from their trainees due to the reduction in clinical activity. And the last area that we looked at was trainee wellbeing. So of all the studies that looked at stress and burnout levels amongst surgical trainees, all but 1 reported that this had increased since the pandemic. The 1 study that reported a reduction in burnout was a Pakistani study looking at trainees across all surgical specialties, and that was likely because there had also been a significant reduction in their working hours since the pandemic. Again, as you would expect, there were reports of home life disruption. Some studies reported financial worries amongst trainees, and that was largely trainees that were due to start a fellowship or a consultant job, because that was then thrown into uncertainty. And in terms of health concerns, most trainees were more concerned about the health of their loved ones, so the risk of them bringing COVID back home and infecting a family member, as opposed to the risk to their own health. And as touched upon before, there were also concerns about career prospects in securing fellowships and whether they will be ready to move on to consultant jobs after the pandemic. So in terms of the strengths and limitations of this paper, if we start off with the strengths first, this was the first systematic review looking across all surgical specialties, and we focused on all aspects of surgical training. I think it's very easy just to look at the operative impact, but surgery is multifaceted and all areas of surgical training have been affected. And we've managed to include a range of countries and surgical specialties in the review. I think the fact that only 1 study is from the UK is based on the timing of the search. So we did this quite early on during the first wave of the UK pandemic, and that's probably why not much research at that time was published. And when we think about the limitations, there's a lack of quantitative data, for example, in terms of operative casebook numbers pre and post-COVID, so we couldn't perform a meta-analysis. And the nature of the pandemic was that it was a rapidly evolving situation with different countries having different peaks. And so countries that had peaked earlier might have been able to mount more of a response, and that will affect the quality of the research and the strategies that they had used to mitigate the impact. And the majority of these studies use survey data, which is obviously open to response bias. And again, that was probably due to how rapidly things were evolving and the need to get some quick studies out there. So we concluded in our paper that the COVID-19 pandemic has affected all aspects of surgical training, not just operative impact. And this has been felt globally and across specialties as well. And moving forward, the delivery of training is going to need to move away from the traditional models of learning if we're to redeem and to recoup the experience lost. And in terms of further studies that are required, we really need to quantify the impact of the COVID-19 pandemic and also to implement strategies to try and minimise the ongoing disruption that it is causing. In terms of the UK response so far, we've had 2 new ARCP outcomes, so 10.1 and 10.2, which are the no-fault outcomes related to disruption of training because of COVID-19. And there is also the out-of-programme option, which relates to disruption, again, caused by COVID-19. So in terms of the discussion points from this article, which we will continue to discuss over on Twitter, one thing is, does this align with your own experiences of the impact of COVID-19? There was only 1 study from the UK, so it would be interesting to see whether our experience mirrors that of this review. And do we think that trainees at different grades will be affected differently? So some studies in this review suggested that those more senior would be affected, but what do we think about those that were ST3, ST4 during the first stage of the pandemic, where they've had a significant reduction in operative experience? Will they be able to catch up? Have certain specialties suffered more? So specialties that have more of an elective burden than emergency burden, do we think that they will be disproportionately affected? Those that have more of a trauma or emergency aspect, they might have been protected to a certain extent with their emergency numbers. And with the switch to online teaching and conferences, do we think that should continue after the pandemic? There's obviously advantages in terms of cost, study leave, logistics of travelling to a different country, and there's also disadvantages in terms of networking and social aspects. And have you seen a noticeable difference in trainees as a result of the pandemic? And probably the most important question for all of us is how can we mitigate this impact, and what can we do practically to get our experience back up to scratch? And the Twitter handles are on the right hand side. We hope that you can join in the discussion. Thank you.